medicine.com. And if you have any questions regarding health or anything, you can go ahead and email me at drtimko@gonsteadphysicalmedicine.com. For those who don't know me, I see a lot of familiar faces, and welcome to those. For those who don't know me, again, my name is Dr. Timko. I'm originally from Western Pennsylvania, outside of Pittsburgh, and did my undergraduate studies at the University of Pittsburgh. Went on to receive my doctorate degree from chiropractic from Sherman College in South Carolina, and been in active practice for the past 27 years, obviously doing chiropractic, but also physical medicine modalities, therapeutic procedures, functional medicine. I've been working with thousands of people over the last 27 years or so, helping them restore their health. Currently, again, as I mentioned, working at Gonstead Physical Medicine. It's a multidisciplinary practice. We have 3 or 4 chiropractors working there, a naturopathic medical doctor as well, a physical therapist. We have massage therapists. We do, as I mentioned, functional medicine, chiropractic, physical therapy, rehab. We have nutrient IV therapy, along with a multitude of other services. So why is posture important to us? That's, of course, why we're on the class here today. Well, unfortunately, most of us were never really taught proper posture. Or if we were, it was from our parents or large-scale school drills telling us to sit up straight, or don't hunch your back, or don't carry your backpack or your shoulder bag on one shoulder. But we were never really taught why. We were told we should, but we were never really explained why posture was so important to us. In fact, the majority of us go around unconscious and unaware of the effect that posture is having on our physical and mental health. And you don't really think about how mental health is affected by posture, but it certainly is, which we'll talk about here as we move along. We are often oblivious to the potential for maximizing our energetic levels, which good posture will provide for us. So today we're going to discuss the following benefits of correcting your posture. The first one is bone and muscular alignment. We want to make sure good posture is going to create the best alignment within our bone structure and within the muscles which are attached to those bones. We're also going to talk about the effects of posture on the joint surfaces, particularly with cartilage. One thing we don't think about often is how posture can affect our breathing. And so we want to talk about how proper posture can create an optimal effects of breathing. An altered posture can also create fatigue within the body. Altered posture, we don't think of it often as well, but can create alterations with our ability to communicate with those we are around. Altered posture can also affect our moods. And of course, as a chiropractor, we have to talk about spinal health and posture as well. Also, we want to talk about posture-associated complications. Then we're going to talk a little bit about body awareness and how to become more aware of posture, along with what is actually proper posture. And then talk about some postural abnormalities, and also we're going to talk about how to improve our posture. And just a note for everybody on there, also we can hear some background noise. If anybody's on there and they haven't muted yet, please go ahead and mute so that we're not hearing some background noise in there. Also, as far as questions go, I know that they had sent out an email regarding how to raise your hand. I'm not going to be doing that in the class because we're going to get too much interference in doing that. I will stick around at the end, though, to answer any questions anybody has. And so if you do have a question, either remember it or write it down so you don't forget. And at the end of the class, we're going to go over and answer all the questions, so that way everybody who has to go can go, and those who want to stick around and listen to any questions can stick around, and we'll do that. So the first thing we're going to talk about in relation to posture is bone alignment. One of the major reasons why good posture is important for the human body is to ensure that the bones and muscles can continue to grow and flourish in the healthiest alignment possible. Positioning the body in its optimal state with regard to gravity and the forces working against it is ultimately what posture describes. And that's our biggest foe when it comes to proper posture, is gravity. Gravity is always pulling us down, pulling us forward, pulling us in that forward posture and trying to drag us down. And our body's muscles, ligaments, and tendons and joints are working against that to try and keep us in a correct and upright posture. But again, gravity pulls down, and weakness in muscles and joints can create that abnormal posture. Posture is key to helping us heal, grow, and manifest in the healthiest way possible. Alterations in posture, especially for lengthy periods, can alter bone alignment and lead to degeneration, and certainly predispose us to injury, arthritic change, osteoporosis, osteoarthritis, and a multitude of other issues that can create altered health of our bodies, and particularly within our joints and muscular structures. Speaking of muscular alignment, we know that healthy posture is vital to ensuring the continued growth and development of the muscles as well. The more muscles are cultivated in a certain movement pattern, the more they grow to inhabit this place in space. And what do we mean by that? I'm going to use an example of forward head carriage or forward head posture. We've all seen people who are sitting up nice and straight, their heads over their shoulders, and they look in a good upright position. We've also seen those people where the head is way out in front of the rest of their body. We call that a forward head carriage. Now imagine that forward head carriage. If we stay in that position for an extended amount of time, the muscles in the front of the neck are going to begin to shorten, and they grow within that shortened pattern, and they stay shortened. The muscles in the back of the neck are going to lengthen and stretch, but they're also going to tighten up underneath the skull and in the shoulders, the trapezius muscles, from holding that head in that forward head carriage. And so those muscles, as it says, grow to inhabit this place in space. And so oftentimes, if they've been that way for an extended period of time, it can develop trigger points and spasms and multiple other issues that we then have to rehab. And we do a lot of that rehab when we're working with patients in the office, and I see altered head carriage or imbalances within the pelvis. We're going to teach them how to stretch those shortened muscles and strengthen the other muscles to hold things back in the proper position. Thus, it makes sense that repeated muscular engagement in a certain way will cultivate habitual movement and posture, and if this habitual posture is not correct, it can cause lasting damage. Now, we know that altered posture can affect joint health. We know the surface of your joints and the interaction that bones have when they move in relation to one another is the very foundation of postural health. And so we said that if we have altered bone structure, it can affect the bones, but more importantly, altered bone structure will affect the joints and can degenerate those joints. The human skeleton is a carefully structured and intricate web of these joints and connections. As such, they require just as much awareness as the overall picture of optimal or optimum posture. Correct posture decreases the abnormal wearing of joint surfaces, which are composed of substances known as articular cartilage. And that wearing away of cartilage within a joint is called arthritis, in particular osteoarthritis. In this way, we can understand how incorrect posture can over time lead to the development of diseases such as arthritis, osteoporosis, osteochondritis, scoliosis, and others. And this is one of the most common findings when I x-ray my patients, and we can see it within the joints of the spine or within the shoulder, the knee, the hips, and we see this wearing away of those joints. When we look on an x-ray, we can see the joint space, and that space is where we have the cartilage on the upper and lower part of the joint, and oftentimes synovial tissue or synovial fluid between the joint, and we can see that joint spacing. We know what a correct joint space looks like. When I x-ray someone with altered posture or altered alignment, over time we will see that joint space begin to diminish, and the narrowing of that joint space and then the wearing away of the bone structure is a telltale sign of osteoarthritis, or degenerative joint disease, as it's also called. One thing we don't often think of when it comes to posture is posture's effect on breathing. We know that the muscles of the diaphragm protect the rib cage and support it to ensure optimum levels of breath can be taken in a safe and effective manner. The majority of people are only breathing to around 30% of the entire lung capacity. That's pretty amazing when you think of that. because we know that oxygen is so important for so many things. Obviously, for our energy levels, it's a primary thing that helps with energy. Also important for immune function. It helps to reduce inflammation in the body. It's important for so many things. And if we're only utilizing 30% of our lung capacity, that's actually pretty amazing. Think of the benefits if we could increase that to 40 or 50 or 60 or 70 or even 100% of our lung capacity. One of the primary reasons that we're not breathing to optimal capacity is the lack of correct posture. So I'm going to give everybody an example of this. And what I want everybody to do is, if you're sitting, I want you to sit up nice and straight. If you're standing, go ahead and stand up straight. We want to make sure that you're sitting back in your seat with your back up against your, hopefully your lumbar support, either in your chair, if you have a lumbar support in your chair. So sitting up nice and straight. I also want you to concentrate on bringing the shoulders back. So if your shoulders are rolled forward, kind of bring the shoulders back. Then also, I want you to think of moving the head back over top of the shoulders so that the head is sitting over top and not sitting out in front. Now, we're all going to take a nice deep breath. I want you to take the breath in through the nose and then out through the mouth. Ready? I'm going to breathe loud so you can all hear me. Let's do it together. Okay, one more time, but now I want you to concentrate on how deep that breath is, how much oxygen you're taking in. You can even listen to mine and hear how much I'm taking in. You ready? Okay, now that we all have that and we know how much oxygen our lungs can hold, what I want us to do is get in an improper posture. I want you to kind of slide forward in your chair. I want you to kind of roll your shoulders forward, kind of lean over, put the head way out in front, and sit in this really bad posture. Now, let's take another deep breath and see how much oxygen is going into the lungs. So let's do that again. If you can hear me, you can hear how little oxygen is entering my lungs when I'm in that position. I would say that it's at least 30% of my capacity compared to the 100% of the capacity when I'm sitting up straight. So you can imagine if we're sitting in a poor posture or standing in poor posture all day long, how much that's affecting the oxygen that's going into our bodies and affecting our health in a multitude of different ways. So by straightening the spine and reducing the tilt in the pelvis when we're in that seated position, we give more freedom to the diaphragm muscles to take deeper breaths. So that's important for us when we're sitting, especially sitting at a computer for extended periods of time, sitting watching TV or doing desk work, to make sure that you're keeping that posture upright. And in fact, I would recommend every 20 to 30 minutes while you're sitting at a computer or sitting anywhere is to just realign yourself, make sure that you're sitting up straight, and then take a couple deep breaths so that your body can remember what that deep breath is like, and so you can get oxygen to your body. It'll keep you from getting fatigued while you're working, while you're sitting, while you're doing watching TV even. So it's important to be able to maintain that posture for increased oxygenation. Of course, we just talked about how decreased oxygenation can create fatigue, but there's other things that can create fatigue as well. In a bad postural stance, not only are the lungs often overcompressed and prevented from providing enough oxygen to convert into energy, but muscles are also compressed and will require extra energy to support the skeleton in this unnatural state. As such, we wind up spending more energy than necessary on muscular support and keeping ourselves upright. Let's go back to that example of forward head carriage again. So when that head is forward out over the body, the muscles in the back of the neck, the trapezius muscles, the levator scapulae muscles, occipital muscles, all those are working hard to keep the head from falling forward. In fact, a head over top of the shoulders uses relatively little muscles to hold it there. As it moves forward, it increases the stress on those muscles. Now, our head weighs about 15 pounds. And it's been said for every inch of forward head carriage we have, it doubles the weight of our head on our shoulders. So 1 inch of forward head carriage now makes our head feel like 30 pounds. 2 inches now makes it feels like 60 pounds. And those muscles in our neck are trying to keep that head from falling forward, using up extra energy, over time tightening up and creating trigger points within those muscles. In fact, those with chronic fatigue syndrome, when we're doing treatments with them, those treatments often include posture correcting exercises in the course of treatment. These exercises place emphasis on proper alignment of the bones and muscles to ensure an optimized and consistent state of maximized energy. So if we can do that with our chronic fatigue patients, we can do it with all patients that are having fatigue. Getting proper posture can reduce that fatigue and those trigger points in our body that can lead to a multitude of other issues and problems. We don't often think of how our posture affects our ability to communicate with others. But relatively speaking, we know that it's easier to effectively communicate with someone who is calm, relaxed, open, and in a positive frame of mind. All of these qualities are either consciously or oftentimes unconsciously manifested through our body language. And this certainly has a direct relation to posture. We know that bad posture causes energy to quite literally get stuck in areas of the body which were not designed to hold or process it. That's why adjustments to the body, muscle work, doing massage therapy or Reiki, even acupuncture is so important to release these areas where energy is stuck. Stuck energy has many different ways of manifesting itself, most commonly as negative emotions or unconscious, seemingly reckless actions. And so we don't often think how our actions and emotions can be affected by posture, but it certainly is. Again, talking about how posture can affect emotions, it certainly can affect your mood. In fact, there are a surprising amount of correlations between proper posture and elevated mood levels. When individuals are not engaging in proper posture, it's likely that their gastrointestinal tract will be pressured or compressed in one way or another. You're saying to yourself, what the heck does the gastrointestinal tract have to do with posture and mood? Well, it has a direct effect. But to give you this example, again, let's go into that forward head carriage, rolled shoulder, bad posture that we did earlier when we were showing you the difference between breathing. But if we do that, feel the compression on the stomach, how the rib cage pushes down on the stomach and the intestinal area. That compression of the gastrointestinal tract will alter the movement of food and waste material through the gastrointestinal tract, which we call peristalsis. That alterations in movement through the gastrointestinal tract can alter digestion, the absorption of minerals and vitamins, nutrients, also alter our bowel movements. So it's extremely important to have good posture in relation with gastrointestinal function. This lack of proper digestion and absorption of nutrients in the gut with bad posture contributes to what has become understood as the gut-brain axis. This has a direct effect on neurotransmissions to and from the brain, which affect our overall sense of well-being and positivity. Our major mood-enhancing hormone called serotonin, actually 80% of that is produced in the gastrointestinal tract. We often think of neurotransmitters as being produced in the brain, but a lot of them are being produced in the gastrointestinal tract as well. When I do my class on the gastrointestinal system, we talk about specifically how alterations in gastrointestinal function can affect the brain function as well, obviously affecting mood, but a multitude of other things as well, anxiety and depression and others. So it's something we don't often think of, but posture certainly can affect our mood. Now, we can't get through the class without talking about the spine. I am a chiropractor, of course, at heart. And so let's talk about how altered posture can affect the spine as well. The spine is an intricate structure comprising of many webs of nerves, muscles, and important pathways through which energy can travel around the body. In fact, we know that the brain sends electrical impulses down through the spinal cord, which is protected by the spinal column. In between each of those vertebrae, nerves exit off and go out to the body. And the brain controls and coordinates all functions of the body through the spine, throughout the spinal cord and nerve roots. Correct posture is more than just a cosmetic recommendation, as we've seen throughout looking earlier at the joints and the muscles and ligaments and tendons, but also with the nerve function. Correct posture is a vital factor in overall health. Back and neck pain are two of the most common complaints which are directly caused by poor posture. And as you can imagine, I see this every single day. And so when we're treating somebody's back and neck pain, certainly the adjustments can take pressure off the nerves and can relieve the pressure on the muscles and alleviate a lot of that back and neck pain. But if we don't correct the underlying cause of the problem, which is oftentimes altered posture, those problems are just going to come back. That's why it's so important for me to utilize rehab work in my treatment of patients with back and neck pain so that we can stabilize their spine so that the problems don't continue to come back. Other issues with the alterations of the spine include headaches, fatigue, and possibly even concerns with major organs and breathing. Again, alterations within the spine causing curvatures such as scoliosis or what we call kyphosis can create pressure on the organs themselves or pressure on the nerves that are going to those organs and systems and create a multitude of health problems. So having good posture within the spine is extremely important for our body's overall health and well-being. All of these are associated with the spine being held in damaging positions for prolonged periods of time. So all of these alterations are affected by the spine being out of alignment. So posture can be responsible for at least a contributing factor to the following complications. And we listed all these earlier, but I kind of wanted to go through and put these in a list so that we can have those and we can understand how poor posture can affect our health in a multitude of different ways. We know that poor posture can create shoulder and back pain, as we just mentioned. We also mentioned how altered posture can affect gastrointestinal and digestive problems, creating a multitude of issues. We said that altered posture can create shortness of breath, decreasing oxygenation to the body, creating fatigue, creating altered immune function, and again, a multitude of other things. We know that altered posture can create neck pain. With that neck pain, often it's associated with headaches caused by pressure within the muscles within the neck or from the nerves going out of the neck into the head. We know that altered posture can create fatigue and altered emotional states, as well as arthritis and degeneration within the joints. And so hopefully we touched on all these things. You have a better understanding of how altered posture can affect your body in a multitude of ways that can create a multitude of different symptoms. Now that we understand what altered posture is and how it affects the body, we're going to talk a little bit more about what proper posture is and what body awareness is and how the effects of proprioception are on that. It's widely thought that the overall most important factor in optimizing our physical posture is simply to cultivate higher levels of body awareness. And so maybe that, that teacher that smacked the desk with the roller and told you to sit up straight was kind of instituting within you that subconscious awareness, and that's kind of good in those ways as long as you weren't scared by it. We know that studies have shown that those with higher levels of body awareness generally experienced lower intensities of physical illness than those with lower awareness. So once again, going back to that seated position that we spoke about earlier, once you become aware of what proper posture is and how we want to be seated or how we want to be standing, then when you start to go out of that proper posture, your subconscious kind of gently reminds you, hey, you're slouched forward and you just want to sit up straight again. Because I talk about this all the time, my awareness is amazing. I'll be driving down the road in my car and I'll look over at the person next to me at a stoplight and I can see them slouched and their head forward, and I'm like, and I think to myself, oh, sit back up straight. You want to sit up straight. So I'm constantly reminding myself, even giving this class, and we've been talking about this, so hopefully all of you are sitting at home and you're recognizing when you're starting to slouch forward and your head's going forward and you're kind of just telling yourself, sit back up straight again. So having that awareness of what proper posture is, which we're going to review here in a moment, is extremely important so that your subconscious, you actually train your subconscious when your body begins to go out of that proper posture to right itself back into good posture again. So by observing things like gait or our body movement as we're walking, repeated movements and repeated instances of particular illnesses and imbalances, we can cultivate greater body awareness. So sometimes we can associate altered body positioning with certain ailments that we have. And so with my patients that have headaches, and I notice a lot of them have a forward head carriage, again, compressing the muscles in the back of the neck, creating pressure on that neck. So when they're telling me, well, when I'm working and I get about halfway through the day, I start to notice that I get a tension headache. So I tell them about their posture and I say, when you feel that tension headache coming on, go ahead and sit up straight. Get the head back in a neutral head position. I may show them some stretches to do so that they're more aware of getting themselves in a position that can alleviate those headaches throughout the day. And this can be in any particular issue that you have. A lot of times correcting the body's posture can alter some of the symptoms that are created by altered posture. So here's some pictures that are showing us proper posture. Let's go ahead and look at the middle picture first. This is obviously somebody in a seated position, and we're saying that this is a correct seated position. Let's talk about why this is correct. So we're going to start looking at the dot in the middle of the person's head there from the side. You can see the dot is in the middle of the head. If we come straight down from that, we'll see that that dot is over the neck, and the next dot is over the shoulders. So that's telling us that the head should be over the shoulders. So if we're looking from the side, our ear hole should be right over top of our shoulder. That's where we want it to be. Now that's not in the majority of people. The vast majority of the people we're going to see is the ear is way in front of that shoulder. But that is a correct posture that we want. Now not everybody can be in that posture. If you've had altered posture for many years and have arthritic change or degeneration, that posture may be uncomfortable for you. So we don't want to go the complete way back into the proper posture if you're unable to, but you want to get into the best posture possible where you're still comfortable. Looking at the shoulder now and moving straight down, we can see the next dot is on the hip. So we know that the shoulders should be aligned over top of the hips as well. If we look at the arm alignment now, we can see the line coming down from the shoulder and going to the arm alignment. Our arm angle should be roughly between 90 and 120 degrees. Essentially what that means is your arms should be at your sides, and you should have an approximately 90-degree angle when you're using a keyboard, or when you're writing at your desk, or when you're holding anything or working at your desk. We don't want the keyboard to be above that 90 or 120 degrees, because if it is, you begin to lift the shoulders up, and over time it's going to create tension within the shoulders. We don't want it to be below as well, because that can create problems as also. Let's look at the knee position now. We see in this particular picture that the knee is almost directly across from the hip. We can see that this person has their feet placed on a little support to raise that knee up. The reason we want that is because if that knee is below the hip angle, it's going to begin putting pressure on the back of the legs and put pressure and decrease blood flow into the legs and into the feet. Can often lead to foot fatigue, cramping, even numbness and tingling in the legs or the feet. Now let's look at the person looking at the screen, or whether we're looking at a monitor for a computer, or whether we're watching TV or some sort of presentation. We want to try and get the head looking straight forward at that screen. We don't want the monitor or the screen to the right or to the left. We want to keep it in front of us, and we want to keep it looking so we're straight ahead, not looking up or down. Now let's look at the correct standing position. That's the picture over on the right of your screen. Again, we'll see the head is over the shoulders over the hips, but now we've seen that the hips are over the knees and the knees are over the ankles. So that is the correct standing posture. Again, if you're working position, we can see again that your standing station should be keeping your arms at that 90 to 120 degree angle. And again, the monitor of the screen should be directly in front of you. So now that we know what correct posture is, let's look over to the left and what an incorrect posture is. And this is what we often see when we watch people who are in a seated position, either working or classes. If you look around you at a class at Rise, when hopefully it opens up again soon, you'll see a lot of this posture. So the first thing that we note is the head is way out in front. Again, we call that a forward head carriage or a forward head posture. So the head is out in front of the shoulders. We see that the shoulders are out in front of the hips. We see that the seated position, the knee is below the hips, and so the chair is pushing up underneath the person's leg, decreasing blood flow into the legs. We see that his screen actually happens to be down in front, so he's also looking down at the screen. He's not sitting back in the chair all the way, and that's what I didn't mention in the good posture position. We should be sitting back in the chair as far as possible with a good lumbar support supporting us. If your chair doesn't have one, you can purchase lumbar supports, or if you're a little too short and sitting back in the chair is difficult for you, sometimes getting a thicker lumbar support can allow you to slide more forward on the chair, but still be in a correct seated position. So it's really important to have that good lumbar support. In fact, if you have a good lumbar support, it almost forces you into a more upright position. So that lumbar support is extremely important for you. Okay, so let's move on from this now that we know what good proper posture is and what the wrong sitting posture is. Let's look at how the imbalanced posture or unbalanced posture can affect our body's joints and create problems. Again, let's look at the balanced posture first, starting at the feet, at the person in the balanced posture. You can see that the feet and the ankle joint is lined up with the bottom leg bone called the tibia. So you can see how the tibia is right over top of the ankle in a nice straight position. As we move up into the knee joint itself, you'll see how the knee and the femur are fit together in a nice position there as well. Moving up from along the femur or the leg bone into the hip joint, we can see that the pelvis is level. And you can see that arrow going across from right to left showing that we have a level pelvis. We can also see that the spine is nice and straight from this position and that the shoulders are leveled as well. We can also see the head is leveled if we look at the eyes straight across from one another. So this is what I often do with my patients that come in. I shouldn't say often do, I do with every patient that comes in, is I have them stand in front of me looking at me, and I'll look at their eyes, I'll look at their ears. Now, not everybody's ears are level, but we want to see that the eyes are straight across from one another and are fairly level. The head is sitting level. I'll also put my hands on their shoulders. I'll put one hand on the right, one hand on the left, and then I'll just step away with my hands in that position. And I'll actually show the patient, look, we can see that the right shoulder is higher than the left shoulder, or left higher than right, or whatever it may be. I'll also then put my hands on the top of their pelvis. Once again, I'll step away, and we can see, is the right side higher than the left side. So you can do this in the mirror, or you can have a spouse, family member, friend do this for you as well. So you can look in the mirror and look at yourself. Is my head level? Are my shoulders level? Are my hips level? If they're not, then we know that you have an altered posture that can create alterations within the joints of the body and all the other muscles, ligaments, and tendons that we spoke about earlier. So if we look at the unbalanced picture on the left, let's start down at the bottom and see where a lot of postural problems begin, and that's within the feet. If the arches of the feet have dropped down, or you have flat feet, particularly if one foot is worse than the other, it can cause the foot to roll in or out. In this particular picture, we're seeing how the foot is rolled internally, which is called pronation. As that ankle moves internally, that can create a multitude of problems within the foot. If you're standing on that foot, walking over an extended period of time, that can create bunions. It can lead to plantar fasciitis. It can cause degeneration within the ankle and a multitude of other problems within the foot. As we move up from that altered foot movement, we can look at the knee joint now. We can see how the tibia and the femur are not aligned properly. That alteration is going to cause degeneration within that knee joint. So if you have this problem over an extended period of time, these are the folks that are going to end up having knee replacement surgeries because that knee is going to wear away. If that knee is buckled in the way that we see it, or knock-kneed, or genu valgum as we call it, that's also going to drop the hip down on that same side, as we can see the alteration of the pelvis in this picture. That's going to put more pressure on the hip and could potentially lead to degenerative hip problems and eventually lead to hip replacement surgery. We can see with the pelvis being unleveled, it's creating a curvature in the spine. We call that scoliosis. That's going to affect the joints within the spine and can lead to arthritic change and degeneration within those joints. If we look at the shoulders, we can see now the shoulders are unbalanced. The right shoulder is lower than the left. That's going to create shoulder pain, scapular pain, arm pain. We can see how the alteration is going to affect the head as well, with altered head carriage, and create pain within the neck. Also could potentially create headaches and a multitude of other issues. So again, we can see how the balanced person structure doesn't put excess stress within the joints any more than gravity is already doing, whereas the unbalanced person can create problems the whole way up. Oftentimes, we do find that these imbalances are caused by foot problems, and so the feet are extremely important when looking at proper posture in a standing position. And so we'll do a digital foot scan on our patients to determine if their feet and all the arches in their feet are in the proper position. If not, I oftentimes recommend orthotics to be put into the feet to balance those out. Sometimes we even need to use a heel lift. For example, myself, my left femur head is about 8 millimeters lower than my right femur head. Part of that is because my feet are slightly pronated from years of running and track and football and other basketball and other events that I've done, where I pounded my feet down, my arches down. And so my arches are flattened, my feet are pronated, one more so than the other. So when I wear orthotics, that balances me out to a certain degree, but my femur heads are still unbalanced because my one leg is actually shorter than the other. So I need to use a 5 millimeter heel lift as well under my left one. Now, when I have the orthotics and the heel lift in, when I re-x-ray myself, my femur heads are perfectly balanced and my spine has straightened out, which can have long-lasting effects on my health and certainly can on yours as well. So we do this with all our patients that have unbalance, that have scoliosis, that have hip imbalances, is we'll check to see where those problems are. If they're correctable, we're going to go ahead and do that for them. This is an actual x-ray. When I was telling you earlier about what mine looks like, we can see that the one on the left is a normal x-ray. The first thing we're going to look at is that yellow line across the bottom. And what we're seeing in this x-ray, just for those who aren't familiar looking at x-rays, is this is the pelvis from the back view. So this is just the person standing looking away at you, and we removed all the skin and muscles are looking at the pelvis itself. And so on the bottom right, that's the right hip joint, and then the left hip joint on the left side. We can see the pelvis made up of the right and left ilia, and then the sacrum in the middle of that. And then we see the vertebrae starting at L5 and going up to L1. There are 5 lumbar vertebrae. Those are the vertebrae in the low back. We can also see some of the thoracic vertebrae as well, starting at T12 and going up to T11 and T10 where the rib cage is. So again, we're looking at the person from the back view. If you looked at the bottom again at that yellow line, you'll see that their hips or their femur heads are perfectly level. As we move up to the top of the pelvis, right underneath where the R is, for the right side, we can see again that the pelvis is level. We see the sacrum is level. We see the spine is nice and straight. This is a normal x-ray, what we want to see when I x-ray someone. What I often see is this next x-ray. And what we're looking at here, again, looking at the femur heads, we're seeing that the left femur head is almost 13 millimeters lower than the right femur head. Because of this, the pelvis is unleveled and it's creating a curvature in the low back, or a scoliosis, as we've said before. This is similar to what I was explaining to you that I had. Now, mine wasn't this bad. My left femur head was 8 millimeters. The curve in my spine was only about 10 degrees. But when I balanced my feet out and when I added that heel lift and re-x-rayed me, my femur heads were perfectly level and my spine straightened out. You can imagine how much good that's doing for my body, not putting excess pressure on my hips or on my spine. So these are some of the things that we want to look at when looking at a posture from the back or from the posterior view. Now we also want to look at the side or the lateral view. We're going to show you a neck from the side view here on x-ray. And so we see this person is facing to our right. You can see the jaw on the right-hand side, the back of the skull on the left. And we're seeing the vertebrae of the neck. There are 7 vertebrae in the neck. We call those the cervical vertebrae. We can see those are numbered C1 to C7. The curve in the neck is supposed to go forward. The upper back curves backwards, the low back curves forward. This acts like a large spring in the body. So we can see this curve. I've actually measured the angle of the curve. I put a line across the top vertebrae and the bottom vertebrae, C1 and C7, measured that angle, and it comes close to 43 degrees. That's an ideal curve in the neck. We also look at, again, head carriage. To do that, we drop a line down. So you can see up on the top of the skull here, where there's a little horseshoe-looking thing. That's a sella turcica where the pituitary gland sits. We drop a line straight down from that. That line should intersect right in front of the C4 vertebrae. You can see I have it measured here, 6.5 millimeters. Less than 10 is ideal. That's how we measure head carriage. Again, we can look at a person and see it externally, but more accurately, we can get that picture looking at x-rays. So that's a normal x-ray. We can see the vertebrae and the spaces between each vertebrae where the discs are located. This next picture shows a forward head carriage and a loss of the normal curve in the neck. We see this quite often in people who have maybe had a job where they're looking down all day working on an assembly line or doing desk work, or somebody who's been in a hyperflexion, hyperextension injury or whiplash injury in a car accident. They begin to lose that normal curve and they get that forward head carriage. So again, we can see the head carriage is almost 32 millimeters. Remember, that should be less than 10. We can see the straightening out of the curve in the neck. This is going to lead to degeneration within those joints of the neck, causing arthritic change, and again, pressure on the nerves and a multitude of health problems. So we can see from the posterior view earlier, the balance of the spine, and from the lateral view, the curvatures of the spine, and how important that posture is to not only spinal health, but overall health and well-being. This picture shows the generation of what that neck may look like 10, 15, 20 years if it is not corrected. We can see the degeneration within the joints between the vertebrae, lipping and spurring on the edge of those vertebrae, which is arthritic change and degeneration. So just look at that one compared to the one on the left and the difference of that. Unfortunately, I see this so frequently in my office. When somebody is this severe, it's hard to correct it and move it back into a neutral position. But if we can correct it early enough, or find it early enough, oftentimes we can correct and stop this degenerative change from occurring. But even somebody like this, we can still give them help and still help with pain management and stop that degeneration from going to moving forward. So how do we improve our posture? Now, again, I can't look at each one of you individually on a Zoom class like this, so it's almost impossible for me to tell you how we're going to correct the posture. But one thing to understand is your poor posture, is to understand your poor posture and accept that maybe something should change. It's another thing to actually know how to safely do so. So hopefully in this class, we've all kind of realized that maybe our posture isn't quite as good as it should be. If we've recognized that, that's the first step, is recognizing that imbalance. The next step is to actually know how to safely correct that. As with any physical adjustment that we do to the body, any physical adjustments or alignments, optimum posture varies for everyone. And it's incredibly important to ensure that any changes you make are actually beneficial and healthy for your body. Again, that's why in a class like this, I can't tell you all how to correct your posture because everybody's different. Without seeing you in person, without looking at your posture, without looking at x-rays, I'm unable to determine exactly what's causing your altered posture. So therefore, I can't give you the proper exercises to do to correct that posture. Ensuring your posture is correct can outshine the effects of many exercises. In fact, no amount of working out can fix bad posture. If your bad posture is being caused by one leg being shorter than the other, working out is only going to make the muscles on the side that's shorter stronger and the side that's longer weaker, and you're going to actually hold that posture in a worse position. So we want to make sure that we're exercising ourselves in a correct posture so that then we are holding ourselves in that correct posture. So finding out what your imbalances are, correcting those imbalances, and then exercising those muscles while you're in the correct position is essential for everyone. It says we're almost done, but you are just getting started. So hopefully that's true. Hopefully, we're finishing up with the class and you have a little better understanding what good posture is, what bad posture is, and certainly you've maybe become more aware of what your posture is like. But now we're just getting started. Now that you're aware, you have to act on that. Ultimately, good posture is important for so many different aspects of our health and of our lives, as we've seen in this class. The key here is to get to the bottom of your postural difficulties before you embark on a plan of exercises, as I mentioned earlier, and why that's so important. So having a postural assessment and x-rays if necessary is the first step in determining any postural abnormalities. So hopefully whatever doctor you're working with, you have a naturopathic physician, you have a good primary care physician, or maybe you have a chiropractor you're working with. You want to say, hey, have we ever looked at my posture? Could you do that for me? Can you tell me if there's any imbalances with my posture? And if so, can you tell me how to correct those imbalances so that when I'm doing exercises, I'm getting myself in the proper position? If they're not sure how to do that, then you need to find somebody who is going to be able to help you do that. Once any abnormalities are documented, that high hip or the loss of the curve in the neck or whatever it may be, then an expert in posture and structural correction can guide you in determining what exercise or therapy or treatment will best work for your particular posture challenge. And that's going to be essential for all of us. Find out what the imbalances are, correct those imbalances, and then exercise to keep ourselves in the proper alignment. Thank you for watching this presentation. If you have any questions or would like to schedule an appointment, please use the contact information listed here. Be sure to check out my other health-related videos, which can be found on my website or on my YouTube channel under Scott Timko. Remember, it's never too late to regain and maintain your health naturally.